Molweni nonke ngale evening. Welcome to Head to Toe with Dr. T. Siyabulela ngoba nityhune apha ku Channel 26 Mpuma Kapa TV. Sawuhamba nani siphethe impilo yenu, impilo yabantu bonke nempilo yabamelwane usukela enhloko uyotsho eluzaneni. Sino sister wethu namhlanje, professional nurse who is working privately, upha kakhulu kule nto kuthiwa yi-occupational health nakwi-primary healthcare services. Namhla,
Doc.
can you kindly greet our viewers before I would take you further?
Hello, Doc, and ndiyabulisa kubaphulaphuli bakho nakubabukeli bakho.
Enkosi kakhulu for honoring our invite.
Right.
Namhla wenzani phi?
Unamhla yi-professional nurse that went to further his studies and then wenza occupational health nursing, a diploma, that is a postgrad. And then after that, I started working in companies, mostly in motor industries.
Okay.
And then I went to work to a pharmaceutical company. And then it was then, after those years, I think it's plus minus 5 years, of working in and out of different companies. Mm-hmm. And then I started to open my own practice, which is a mostly primary healthcare, okay, but does a bit of occupational as well, and does a bit of, I don't do the other stuff. It's just primary and occupational, yes.
Occupational health nurses, what was bhatalwa kakhulu, is that true?
Yes, get to be honest, nam DS college didn't have hope. I went with that hope to talk about kids. And then, but then when you get to the industry, it's you get more time, than when you work. I used to work in hospital, so I was working 7/7,
yes,
like 12 hours straight, and then you get to work for 8 hours now, so that you have time for your family and all that. That's yes, the money is there, but it's not as much as I thought it was going to be.
Mm.
Yes.
Is that why you ended up opening your own primary health care center?
Actually not. Firstly, my father was in construction. Mm. So after he stopped working, he suffered from lung problems. So that's when I actually developed an interest. And my sister also was working for an automotive industry in East London. So I developed an interest, and I met a doctor also, talked me into occupational. And then and then I loved it. I went there with hope of Imali, obviously, and also with the love of it. Yeah. So I went there. And then when I got there, I got to meet different kinds of people with medical aids, contractors who don't have medical aids. So in that space, then I noticed a gap in the private sector when it comes to primary healthcare.
Yes.
You find out that a person is diabetic and has been diabetic for years, but they actually don't understand the condition. Mm. They don't understand their medication. They don't know their medication. When we are being trained in nursing schools, we go and do rounds in different hospitals. We go to psych hospitals. When you go to a psych hospital, you get a psych patient, they know their treatment.
Yes,
they know what they take.
They
know.
You
can't give them
their dose. No.
Yes. No, this dose is wrong.
Such a dose. I take it so many times. They are very good.
And imagine you're a student and you thought you were giving the right dose, and they will tell you straight, no, these are not my tablets. I don't take this. And then you come back to people that you thought are literate, and then you ask them. The person is only having hypertension. You ask them, what medication are you taking? They don't know. It's a white small tablet with the line. So you must try and...
And they think we know the pills. And we know the names.
Yes,
we don't even know the covers and whatever.
And then it was then that I wanted to actually open a primary, just to do health education more of it.
That's wonderful.
And also I worked in a surgical ward for a long time. So you'd get wounds that are septic, that were not supposed to be septic, if they were managed properly in the primary healthcare level. So I was interested in that, in wounds. I was interested in primary healthcare, which is chronic conditions, to be specific, just to go with the person. And also there's one thing that we lack doing, checkups. We don't do checkups. We take our cars for service, but we never take
People
ourselves.
Don't take themselves for
service. So it is the space that I want to occupy.
Wonderful.
And also during COVID times, we've seen people that we thought they would know, not knowing what to do when they're sick, not knowing what to do when their relatives or their kids are sick. So, and we have information that people don't have, that we took it for granted that they actually know.
Are we doing enough, Namhla, as professionals in terms of we studied big volumes of textbooks and so on? Are we doing enough to give people information, the complicated information that we studied? Maybe we're just blaming people for not coming for checkups and so on. Are we doing enough? Do we access the platforms, funerals, weddings, and so on to give people information? For example, there's a concept that brown sugar is better than white sugar, and you find that a
And brown
diabetic
rice.
is exactly you find that a diabetic is using brown
Yeah.
sugar. They think that is better,
Yeah.
and yet that is sugar. Just the difference is 0.003
Yeah.
and then they die. Are we doing enough? It's good that you said passion drove you because you want to
Yes.
make an impact in terms
Yeah.
of patient education. Fortunately, I'm there also.
Yeah, mostly I think we try, but we're not there yet, because you'd find out that time is usually against us. So in our clinics, you have to see people like in government clinics. Or
Volumes.
yes, you need to see. You have volumes of people. You are 2 nurses with 1 doctor that comes for certain hours maybe, and then you have to see those people before the end of the day. You have to get to those people before the end of the day. And on weekends, you are tired, you want to rest for the next day. So I kind of feel like, yes, we do, but we're not doing enough as the communities require. And in our funerals, we hardly talk even about, for example, if someone passed on due to cancer, we hardly even the cause of death. I was once a speaker in one of my clients' funerals.
Yes.
They wanted me to come and do. It was even before
That's
I
a very
practiced.
good
It was even before I practiced.
opportunity to educate.
Yes. So she had had breast cancer and she had died from it. And she was still young. She was in her 40s, late 40s. So they asked me if I can come and actually talk. And I can talk as much as I can because they don't mind me disclosing.
Yes.
So it was then the time for me to actually tell people, you need to go for screenings. You need to go for pap smears, breast examinations, and all those.
In fact, I need you to dwell much on the screening. What else can we do? What can we screen, and what is the advantage of screening? And we're gonna take a short break, and then we'll come
Okay.
back because primary health care. In fact, even if you look globally in terms of WHO goals, prevention is always
Yes,
better than
yeah,
cure.
yeah.
And the focus in South Africa is actually to focus now on preventative
prevention,
medicine
yeah.
because we've wasted a lot of time on curative
management.
medicine. So it's good that we are driving primary health,
Yes.
but people should know what do we do and why. Then our viewers, stick to your screen. We're gonna delve more into primary health care with Unamhla Fetsane, who is our private professional nurse trained in occupational health also. Enkosi ungancamathela kwi-TV yakho sisekuchannel 260 sithetha nge-primary healthcare services through uNamhla Mfecane, our occupational nurse as a professional nurse privately and also working for a pharmaceutical company. Besathetha nge-importance ukubaluleka kwe-screening, and it's a nice goal and nice drive to talk about the importance of screening because prevention is always better than cure.
Yeah.
South Africa has actually blundered in spending a lot of resources with curative medicine. But now the ruling or the drive from WHO, and now as a country, there's a refocus towards primary health care. Why is it important to pick up as for Sisakal? What is the importance of why should I go to a health center and do check it and dingenando?
Most of the condition, they progress slowly. And then if you pick them up as they start, you are able to be in control of your disease. For example, let me not speak about cancer now. If we pick up that you are borderline hypertensive and you're still young, we can reintroduce a lifestyle. You change your lifestyle, you change your eating plan, and still maintain a borderline hypertensive without even going for treatment. But we need to monitor you. So if you're not screening, then you will notice when your blood pressure maybe has caused you to have CVA.
Yeah.
And then that's when we'll notice, but actually you had blood pressure, but you didn't notice. You thought it was just a headache, and you took Compral and Grandpa what people are actually taking, which is of which I.
So you only wake up because you've got complications.
Yes, yes. It is very important.
So the advantage of screening is that you can prevent complications.
Yes, for early detection of diseases as well.
Yeah.
Because when it's early detected, it means it can be controlled easily.
Wonderful.
Yeah.
Which diseases are you screening at your primary care setting? Can you go through them one by one?
Yes.
What tests do you do? Because people are scared of being pricked or cut.
Yes,
or
yeah.
whatever. What is screening? Can you go through each of the common conditions that we screen at primary care setting?
Okay. Mainly, it's the common ones, which is diabetes.
What do you do?
We prick you, finger prick. And then if then it's suggestive or it's a bit high or it's high, we then suggest that we do a fasting glucose and then we draw bloods and then we send to the lab and then we get like it will give us plus minus 5 to 7 days range of your glucose levels in your blood. And then we can be able to say from there if you are pre-diabetic or you're not. And then we also, if you are diabetic, then we need to monitor your HbA1c. Yeah. So we need to put bloods on you, and then we need to check in a period of 3 months to minimum how is your blood pressure, because you can prick it and you find out at the time you're pricking it's low. But throughout the course of the day,
that's the issue I always raise when people go to clinics, because they wait for maybe 4 hours at the clinic. By the time they are pricked, random blood sugar, find that is 4 and 5 because they're hungry.
Yeah.
And now they write on the clinic card that your sugar is fine. That is why random blood sugar is not a very good tool in terms of monitoring. Thank you for raising that.
That's why you have to take bloods to confirm it. And then also we do screening for hypertension, which is high blood pressure. And then that we just put you a machine and then it tells us your blood pressure. And with that, there is a concept where we get someone who is having a borderline blood pressure, and then we need to look at maybe why is it high? Maybe the person is stressed.
Yeah.
Maybe the person just got hijacked or something a few hours ago. Maybe there's a lot of things that can cause the blood pressure to be high. So we need to monitor first, monitor again, and then if we see that it is really remaining high, then we can start on treatment. And then the other one is that
early start of treatment, then it means you've got an advantage of preventing complications like stroke and kidney damage and heart problems. So that's another advantage of picking it up
and
early.
Also, during screening, there's an intense health education. Because you'd find out that you screen this person for this, maybe someone just comes and say, I want to be screened, I just want wellness screening. So you do all the tests. And then they get surprised now when you tell them that actually your blood pressure is high, your cholesterol is high, and then they don't know. So that's when on screening you give information before you do any test. And then also we do the cholesterol.
Yeah.
And then we take bloods or we do a finger prick. So if a finger prick is iphezulu, we take bloods to confirm with the lab. So if it is high, then by then you would have cancelled the person, given information, and then if they are due to start on medication, then they can start on medication, and then you monitor after that.
And also, that's a chance to advise them on, like we mentioned, dietary management.
Yes,
because,
exercise.
Cholesterol is not going to be painful.
Yes.
That is why it's important for people to understand that those are diseases of lifestyle. They won't cause any pain, they won't cause any shortness of breath, but they are killing you slowly.
Yes,
and
they are
critical
progressing.
Organs. And what else are you screening?
And then
do you do prostate checks?
I am not there yet.
I'm
not there yet.
Scared? Yes. Scared of prostate. Why? I mean, there's gender issues. The reason I'm raising prostate, I'm very deliberate because we see a lot of women with do pap smears.
Yeah.
And how come you're not doing prostate examinations and screening?
For us, I think it's actually the culture that we need to cancel. It's a culture, because even with doing an ECG, for example, if you find a healthy guy and you have to do an ECG, you have to explain properly, thoroughly. You understand? And then you get a budabadala. When I was still younger, but I saw the you understand? So imagine if I have to perform prostate examination to such a person, it's going to be a problem. And then but when a person is at the later stage.
Yes, well,
Then
they're
it
sick
becomes
and
easy. Then
desperate.
they give you. They just, okay, test anis. So I think it's a culture that we need to cancel. Yes.
Wonderful. I'm
Yeah.
glad you're touching on that because this speaks to gender stereotypes, which
Yes.
is something that is confronting South Africa, which is something as professionals we need to always raise.
Yeah.
And especially in the field of circumcision also. We've got
Yeah.
female doctors who are trained on circumcision, and people think they can choose when they
Yes.
come to hospital with complications that, no, I need a male doctor. No, there's no room for that.
No.
A doctor is a doctor, a nurse is a nurse. I always say those people are unisexual. That is why we're working in
Yeah.
tandem.
Yes.
So it's good that is a thought, but patient comfort is utmost important.
Yeah.
It's good that we've got to explain ourselves. We're going to take a short break and then we're going to look at some of the primary care services we are offering. But good that we're emphasizing the value of screening and
Yes.
the value of patient education to build inside.
Yeah.
I like the example of psychiatric patients because
Yes,
they are very good.
They're very good.
They are very good in
They're
terms
very
of
good.
they can educate you.
Yeah.
Our viewers, please don't go away. We're going to take a short break and then we'll be back shortly. Head to toe with Dr. T. Thank you. Enkosi ngohlala nathi, head to toe with Dr. T. Siphethe i-primary healthcare services. Yeyona nto ibalulekileyo leyo ke. Uqala ii-clinics, ii-general practitioners, amanesi lapha ezantsi, ngabona bantu abo bahlola impilo yethu singekaguli so that sizokwazi uthintela ugula okanye sizokwazi ufumana izifo zisaqala. Unamhla usicacisela into yoba if iswekile uyiphikishe kwa-early, if i-hypertension uyiphikishe kwa-early, uyakwazi ukukhusela ii-complications, izinto ezinoba wesa, uchaphazeleka kwentliziyo, uchaphazeleka kwezintso, neempempe zingawa iswekile xa ngabe uyibambe sekulate. Sifuna zingade uthi sekukwi-crisis sokuxhasa yonke into kube khona uza kwagqirha. Sifuna abantu abaphilileyo basondele kumaziko onke empilo to prevent complications and to stick to a treatment to prevent izinto ezinoba wese kunoba sikhona. Umzekelo, izistroke ezivela kuba ipressure zibhabha phezulu for a long time zingakhange zifumaneke. Uthi kakazenzi i-screening ze-prostate,
yeah.
and then that is what we're talking about, le nto kuthiwa zii-gender stereotypes. I'm hoping into yoba people will understand into yoba nurses and doctors are working together and everyone can do anything. That is why we've got so many gynaes who happen to be men. And I've got a few urologists who are women that I know.
Very few.
Yes, very, very few. Busathetha nge-cholesterol.
Yeah.
I-cholesterol abantu banocimba ngamafutha, and then there's do you do the full lipogram okanye nezi-cholesterol only?
We're just doing
So
cholesterol.
xa abnormal cholesterol, then we do
then
the
we
full
do.
lipogram. Then
Yes,
sibone
yeah.
iintlobo zonke zamafutha because ukhona into kuthiwa zii-triglycerides, which can be high, and zichaphazele ke ngoku zibe worse uchaphazela ezinye izinto xa zidibene neenteshe. Zeziphi ezinye izinto that you screen for in your primary care center?
Recently, okay, we do HIV, obviously.
Okay, very, very
and
important.
then, yes, and then people, what I've noticed is that they don't want to go to the clinics for HIV testing just in case they test positive. So when we do it in the comfort of your home, and then when you get the results, you get them like it's you and myself.
Yes.
So you know it's me and you. So they feel comfortable. And then also
There's confidentiality.
they can see confidentiality. So and also we do screening for breast examinations. There are people who are not sure if there is.
It's said that breast cancer is so common in young women.
Yes, Doc. Yes, it is. It is very common. I've seen a lot of young females now with breast cancer, and also males can actually have.
Yes.
And we do pap smears. We do PSAs for men.
Okay.
So sithatha amagazi for amadoda, and then now before mostly it was said you must be above 40 and then you must be there, but it is safe to do so if there's a history in your family. So if there's a history in your family, don't wait for 40 years. So you can actually make it a routine to take bloods for PSA if you are a male, and also to do pap smears. But you need to, it's a risk-based, but it's done 3 years. But if you are at risk, then we do it more often. And then the other thing that I have seen is fatigue and stress. there is a lot of people who are fatigued, sidiniwe.
Yes.
No?
Kakukudinwa thina kuqala
Hayi,
as professionals. We are tired. As
So,
a for that matter.
and then when you look at a person's diet, it doesn't have the required nutrients to supplement the person for the job that they're doing. And for the work that they're doing. See, we are mothers, we are fathers, we are employees, then we need to supplement ourselves and rehydrate also. That's when I actually had an interest, and then I did a certificate in IV fluids and supplementation via IVLY.
Okay.
So I do that as well. So, but I then screen you first if you are fatigued, if you are the signs of fatigue, which is loss of concentration, wanting to sleep, feeling tired
you're
all the
doing
time.
these
Yes.
IV supplements.
Vitamins, yes.
Okay,
IV
sure.
vitamins, yeah.
Zikhona zovusa
So, yes, doc. Yes, doc.
Oh, that's good. That's very
Yes,
good.
doc.
You know, when men talking about supplementation, there are a lot
Yeah.
of things that people need energy for. People are
Yes.
fatigued.
Yes,
we are
yeah,
tired.
yeah,
We
yeah.
are really tired. I was on
Yes.
radio one other day, and then someone was talking about umalale bambile, because people have got this thought, and then suddenly they just fall asleep.
Yes, yeah.
Having a thought and then falling asleep on that, because
Yes.
fatigue
Yes.
is another thing that is important to
Yes.
screen for.
And it's not something that should be normalized. Yeah, no, it's not normal. It's not normal. And then with fatigue now, we would take it as if we are tired. But there are conditions like low iron that are then you would feel tired, low in vitamin B12. Then
Yeah.
you would feel tired all the time. You don't have energy for anything. You are pale and you have fainting spells, all those things, and you're craving soil. And then you would think, sikhule kubantu abatya umhlaba mos.
Yes.
Siyazofuneka uyokha kulaa nto kukhelelwa umakhulu.
Exactly.
And we didn't know. We thought umhlaba yide ohlala uyitye. We didn't know it was it was a symptom of a condition. So it's those things that I screen for as well.
Wonderful.
So it's mostly history taking, health education, screening. If you see our government, Department of Government, the way their charging system, that system is the best system ever. Because you get to a clinic, you get to a healthcare worker, she's supposed to screen you, check your vitals and everything else. And if your condition is serious, then they jump the line to the doctor. So you see a nurse, the nurse screens you, they see from when you enter the door that you're not okay. You need to be referred. So when you get to your GP says straight away that you're not okay. Even if you come for a sick note, then they see that I tell you, why am I not liking your eyes? You understand? So you get to be screened. So we must normalize going to a GP, normalize going to a clinic for screenings. Yes.
Very, very important. And we can actually help a lot of people, and we can prevent a lot of diseases, and we can assist the population.
Yes.
And then in terms of children, are you doing any immunization, since we're talking about preventative medicine? Especially looking at this vaccine to prevent cancer of the cervix.
Yeah. I believe in studying for something before doing it. So I have not started that. It's just developmental stages that I assist in, and then I don't. And it.
Okay.
As Zabundwana and all that.
Okay.
It's just growth monitoring. That's the only thing I do for kids.
Condoms?
Yes, I do. Yes,
Okay.
I do. I do injections. Condoms are free. I direct them where to get them. I don't have them with me. And then actually, I give education for family planning.
Wonderful.
You would find out that someone is on a certain family planning method that is not benefiting them at all, but because when they went to the clinic, that was the only thing that was there, or they had that their sister took Petogen and they couldn't get kids, so they don't want to seek Petogen. And then so-and-so took this and it did this to them, so they don't want it. So you get to sit down with the person, talk to a person, and then also assess the person, and then give accordingly. So I do that as well.
Education, family planning,
Yes.
that is primary healthcare services. Thank you so much, Namhla. Thank you for the insight and keep on keeping on
Yeah.
in terms of the primary healthcare services, screening,
Yes,
education.
yes.
That is where we need to sit on. Thank you, Uchabali Pressure, and Bugela, where to talk with Dr. T, and Aslandela Guapile Communications. That's our Facebook page, also on YouTube and TikTok. See you next time, every Monday, 7:30, Pomakapa TV, channel 260, your favorite channel. Thank you.